This is Dr. Shakil Ahmed. Today I want to talk about iodine deficiency and its common sign and symptoms. Goiter. Swelling in front of the neck is the most common symptom. Thyroid gland is stimulated by the thyroid stimulating hormone TSH to make thyroid hormones. The thyroid gland uses iodine to make the hormones. However, with iodine deficiency, the thyroid gland will not be able to make sufficient or enough hormones. To compensate, the thyroid gland works harder, more works is done by the thyroid gland. And this will cause the cells to grow, to swell up, and to multiply, and that will lead to the goiter. Fortunately, most of the cases are treated by increasing iodine intake, but if goiter hasn't been treated for many years, it might cause permanent thyroid damage. The second symptom is unexpected weight gain. Iodine deficiency will cause low thyroid hormones. And the thyroid hormones control the metabolism to convert food to energy and heat. Low thyroid hormones, the body burns fewer calories at rest, consequently more calories from food are stored as fat. Adding more iodine in diet may help reverse the effects of a slow metabolism. Fatigue and weakness are also considered common symptoms. Thyroid hormones help the body to make energy. With low thyroid hormone, the body cannot make much energy, and it leads the energy level to plummet and feel weak. 80% of people with low thyroid hormones due to iodine deficiency feel tired, sluggish, and weak. Hair loss. Thyroid hormones control the growth of the hair follicles. With low thyroid hormones, hair follicles may stop regenerating. Over time, this may result in hair loss. Hair loss is due to iodine deficiency may stop if iodine is taken. Dry, flaky skin. This is also a symptom of iodine deficiency. Thyroid hormones help regeneration of the skin cells. With low thyroid hormones, the regeneration stops, and this will lead to dry, flaky skin. Thyroid hormone also regulates sweat. People with low thyroid hormones tends to sweat less, and their skin will become dry. Feeling colder than usual. Over 80% of people with low thyroid hormones may feel more sensitive to cold temperature than usual. And iodine deficiency can cause thyroid hormones level to plummet. Thyroid hormones controls the speed of metabolism. Low thyroid hormones may cause it to slow down. A slower metabolism generates less heat, which may cause to feel colder. Thyroid hormones help boost the activity of brown fat. This is a type of the fat that specializes in generating heat. This means that low thyroid hormones could prevent brown fat from doing its job. Heart rate is affected by the iodine levels. Too little iodine may cause low heart rate, while much iodine can cause faster heart rate. Severe iodine deficiency may cause abnormally slow heart rate and may cause feeling weak, fatigue, dizzy, and possibly faint. Trouble in learning and remembering. Iodine deficiency affects ability to learn and remember. Thyroid hormones help brain to grow and develop. That's why iodine deficiency, which is required to make thyroid hormones, can reduce brain development. The hippocampus is part of the brain that controls long-term memory, appears to be smaller in people with the low thyroid hormones. Problems during pregnancy. Pregnant women are at high risk of iodine deficiency. The need to consume enough to meet their own and growing baby needs. The increased demand for iodine continues throughout pregnancy and lactation. If the supply or a supply of iodine is not enough, or if there is iodine deficiency during a pregnancy lactation, the mother may develop hypothyroidism and its symptoms like goiter, weakness, fatigue, feeling cold, and in infants stunt physical growth and brain development may be affected. Severe iodine deficiency may increase the risk of stillbirth. Irregular periods. Heavy and irregular menstruation may occur due to low thyroid hormones secondary to iodine deficiency. Women with low thyroid hormones experience more frequent menstruation cycle with heavy bleeding. Sources of iodine. There are very few good sources of iodine in the diet. This is one reason why iodine deficiency is common worldwide. The recommended daily intake RDI is 150 microgram per day, and it covers almost 97 to 98% of all healthy adults. In pregnancy, the dose is enhanced to 220 microgram per day, while lactating mothers needs more iodine, which is 290 microgram per day. Foods with excellent sources of iodine are like seaweed, cod, oil, yogurt, iodized salt, shrimp, egg, tuna fish, and some others. Best source is to add iodized salt to the meal, and that is 3 grams per day is enough to avoid the deficiency of iodine. If there is doubt regarding iodine deficiency, consult the doctor. The doctor may check for the goiter and take urine sample for the iodine level. Conclusion or pearls. Iodine deficiency are common in Europe and third world countries where soil and food have low iodine levels. Body uses iodine for thyroid hormones. Therefore, iodine deficiency can cause hypothyroidism. Luckily, deficiency is easy to prevent. Adding iodized salt to main meals should help the requirement. And if iodine deficiency is suspected, consult the doctor. They will check for visible signs of iodine deficiency such as goiter, and also will take a urine sample if needed. I hope I have delivered my message to my colleagues, to my society, and to prevent iodine deficiency by educating my people. Thank you very much.